I think it's up there and visible. Very good, you can see it. All right. So we're going to answer some common questions about back pain, just some general things that a lot of people want to know. And then if you have any specific questions, either for yourself or someone you know, and I don't answer that during the presentation, feel free to type it in, or you can come on afterwards and ask it live, whichever way works better for you. Or if there are just some specific things that you don't feel comfortable chatting about on the webinar and you'd like to discuss them more in person, my contact information is on here, and you probably received an email from me just to log in. You can feel free to email me any questions you may come up with as well. So I will get started here. So just generally, who will benefit from this presentation? A lot of this is for people who suffer from back pain and they want a natural solution that isn't going to require pills or injections or surgeries. It's also good for people who have suffered with back pain for a long time. A lot of the clients that we see here, they've gone from doctor to doctor to doctor, and tried physical therapy and chiropractor, massage therapy, and lots of different things, and it hasn't worked for them. So kind of giving people a different approach and a new way of looking at things that maybe they hadn't heard about before, or a new way to kind of look at pain, and some tips that people can use on their own to help overcome it and get back to doing the things that they love. And for people who haven't suffered for a long time, but they just they value their health, they're frustrated that back pain's limiting them from doing some things that they like to do, and just want to be as active and healthy as possible without having to take a lot of drugs. This is also going to be some good information. But here's kind of a brief overview of what we'll cover. Number one, just what causes back pain, or really pain in general. A lot of what people understand about pain is not in line with current science, and so we'll kind of go through some common misconceptions about back pain as well as pain in general. We'll go through what to do if my MRI shows a blank disc in my back. And that can be bulging, herniated, degenerative, thinning. There's lots of words that kind of get thrown around in medical reports. Kind of just having a better understanding of what all that is, and what that means, and what each of those problems means, and what you can do for each of those types of problems. And then kind of getting more into the meat of the presentation, the things that a lot of people are concerned with is just how they can do the everyday things of life better. How can I sit, stand, or walk longer with less back pain? How can I bend better without back pain? How can I lift things without back pain? Maybe just getting a good night's sleep and not feeling as stiff in the morning. And then, the last question is, for people who have had more chronic problems, that if you suffered with back pain for 10 years or more, is there anything else that can be done? Is there anything, sorry about that, sorry about the phone there. Is there anything else that can be done to relieve it, or am I just going to have to live with it? Am I just getting older? And then, like I said, if there's anything that I don't cover, feel free to type it in, and I'll try to answer it as best as I can going along. If you have questions about the specific slide content, or just something totally different at the end, if you want to come on and ask it, we'll have some time available to do that as well. So I will go to the next screen here. Again, this is just educational purposes. This is a live call. It's not a specific examination. So any questions that you do have, they shouldn't be construed as medical advice. I'll give you some things you can try, some things that a lot of people find helpful, but you don't say that, Dr. Candy told me to do this, because we just can't get that detail on a call like this. And then it is being recorded, so just realize that any questions that you ask, they will be recorded, and they're live, and there's other people on this call. So if you have anything that you don't feel comfortable asking, just feel free to reach out individually, and I'd be happy to update. And then, really the goal of this is just to help you understand a little bit more about what we do, how we can help people. And if you do find any of this material helpful, we're going to have some special offers at the end as to some deals that you can get started working with us one-on-one or in the clinic, virtually or in the clinic yourself. So first, to understand what causes back pain, it's really just kind of helpful to understand in general what causes pain. And for centuries, really, there were misunderstandings about really what pain was. There used to be a thought that you have your body and your mind, and that the two of them were segregated, and that your body had one thing going on, your mind had another thing going on, and really the two of them didn't interact. I think I just saw someone else come in here, so thank you for joining us. So your tissues send messages to your brain, but there really aren't pain receptors in your tissues. Your tissues just have receptors that are responsible for different things like chemicals and temperatures, barometric pressures, strain, tension, vibration, and those receptors send messages to your spine. Your spine then relays that over to your brain, and then your brain's job really is to decide, how dangerous is this situation to me, and do I need to do something about it? And if the answer to that is yes, I need to do something about it, then we experience an unpleasant experience that we understand to be pain. And really, the scientific body, the International Association on the Study of Pain, what they define pain as is an unpleasant sensory and emotional experience related to actual or potential tissue damage. So there doesn't have to be something damaged to have pain, and just because you have pain, there doesn't necessarily mean that something is damaged. It's really in that decision, that processing piece, as to this might be dangerous, there might be something that could be damaged, or might be damaged if I don't get out of this situation, or hey, probably not serious. I've stubbed my toe 1,000 times before. I know it's not a big deal. Stop telling me about that. And if your brain decides that, hey, it's not dangerous, don't worry about it, you can actually release some chemicals from your brain that they're really similar to opioids or other really strong pain medications that actually block out pain. They tell your spine, stop sending me messages about it. I don't care about it. It's not important. On the other hand, if something is actually perceived to be dangerous, that, hey, we need more information about it, your brain can say, send me all the information you can possible about it. Do something about it. Get it, run, fight, do what you have to do to get out of danger, but then also tell me more about what's going on. And so in acute pain, the pain that we normally experience in everyday life, you have something happen over here in your tissues. Your tissues say potential danger, send a message to your spinal cord. Your spinal cord then relays that message in equal proportion onto your brain. And your brain processes it and gives you that reaction, whether you do or whether you don't feel pain. However, when you get to the case of chronic pain, that situation changes a little bit. That your brain has been asking for more and more and more information about this problem. And so your spinal cord gets really efficient on sending this potential danger information to your brain. So you may have the same stimulus, the same thing that happens in your tissues or at your back. And when you weren't in chronic pain, when things had just gotten started, that they really weren't that big of a deal. But now that you've been exposed to that pain, either for a longer period of time, or it was an especially traumatic thing like a car accident or an attack that you were violently attacked, something that's a little more emotionally traumatic, that amplifies the danger value. And your spinal cord actually starts sending more information to your brain than it's getting from the tissues. Then your brain makes a decision based off of that input that it's getting, and it says, do something about it and tell me all the information you can, because this seems like it's a really big deal, and I need to know everything I can about it. And so you see that this becomes out of proportion, that what's actually going on, the level of danger that's in the tissues is not quite what the brain's seeing. And a lot of people, when they hear this talk about pain, they think, well, are you saying the pain's all in my head, that I'm just making it up? And a lot of people who are in chronic pain, they've actually been told that by family members or friends or doctors, that you're making it up, you're faking it, you're whining, you're just looking for attention. And none of those things are true. That actually the pain is not all in your head, but it is in your nerves. That the message from the tissues is getting amplified largely through your spinal cord. And then your brain's making good decisions based on bad information. Meaning that if there really was this level of pain, I hope you can see the mouse here, but if there really was this big potential danger that it sees, it's going to make really appropriate decisions based off of that level of danger. But the reality of the situation is that it may not be a herd of elephants that's running at you. It may be ants. And your brain makes the decision based off the input that it gets, from the input coming in from your tissues, all of your past experiences about pain, everything that your brain has to draw on, draws on all the available information to say, hey, I need to do something. And I know you kind of spent a lot of time on that type of information, but it's really important, because if you go about treating chronic pain the same way you treat acute pain, it's not going to get better, because acute pain is very tissue-based. The information is almost all coming from the tissues. By the time you get to a chronic pain, there's this sensitivity, this increasing sensitivity of the alarm system in your spinal cord, that really at that point you're treating the alarm system. You're treating the system problem, not the tissues. And so having repeated injections, or even doing physical therapy stretches to treat the tissues, having massages, going to see the chiropractor, if all you're doing is just treating the tissues over and over and over with a bunch of different treatments targeting the tissues, the pain never really goes away, because you have to not only address the source tissues, and a lot of times there is a lot of physical work to be done, a lot of work on what's going on in the tissues. If the system's really sensitive, none of that makes a difference. So you have to kind of treat the system problem on one hand, and then treat the tissue problem on the other hand. So it's sort of two simultaneous treatments. And when you only go down one path, you're treating only the system problem or only the tissue problem, then things don't get better. So next question, what if I have a bulging disc, herniated disc, degenerative disc? Those are all terms that you see on x-ray reports and MRIs, or the doctor may tell you that when you go into the office. And really just kind of understanding what they are and what they mean takes some of the danger value out of it. And that, as we saw in the last slide, that really pain is your brain's danger warning system. It's your body's system to say, hey, something bad could be happening, do something about it. And just kind of understanding the whole situation of what's going on with these bulging, herniated, and degenerative discs, it helps take some of the fear out of it, some of the danger value out of it. And actually, learning more about pain itself actually helps decrease the pain. So this is kind of what a normal disc looks like here on top. It's normally like a spacer. They describe it like a jelly donut. You can't see the cross section, but there's a hard outside and then a softer inside. They describe it a lot. The jelly donut analogy is probably the most familiar one. And typically that disc, it supports the two vertebrae above and below it, and gives it some good structure, makes it solid, makes it resistant to the compressive forces from gravity pushing down on you all day. The two vertebrae put together with an intact disc, they can withstand thousands of pounds of compression without being irritated. So your spine is actually really, really strong. When degeneration happens, basically that's a normal age-related phenomenon that people see. We've got some statistics on that in the next slide here, but as you age, your tissues lose water content, and so that hard outside, it starts to shrink a little bit. becomes a little less high, and it starts to shrivel up a little bit. And that's really, for most people, not a serious issue. A couple things do happen with that. It brings the joints, these facet joints here in the back part of the spine, it brings them closer together. And it also narrows the little holes where the nerves come out. Type in the chat if you can see the mouse, otherwise some of this is probably not making sense what I'm saying. But the hole here where the nerve comes out, that gets also narrow as the disc decreases. You can see down at the bottom, as that gets further and further, you have less and less margin of error. The joints start pressing together more quickly. The nerves have less space to move. Doesn't mean there's no space. It doesn't mean there's nothing that can be done, but you just don't have the capacity to get away from, you just don't have the capacity to do some of the things and get away with it the way you used to when you were younger. But for people who have thinning discs, there are still ways that you can position your body. It actually helps relieve the pain and allows you to continue to do, for the most part, the same things that you used to do when you were younger. If you're 70, probably not going to get back what you had when you were 20, but it's definitely possible to rewind the clock 20, 30 years so you feel like you did maybe when you were 40 or 50. A bulging disc down at this third level here, there's just basically a little portion of that outer side that's pushing out. And for most people, that's not a problem at all. It's a really, really, really common finding. I think starting at about 30s, people without pain start having bulging discs really commonly on their MRIs. And usually people don't get an MRI until they're actually having pain though. So when you see that bulging disc, people get a little bit worried about it, but bulging discs are really pretty normal. Herniated discs come out a little bit more into the spinal column, and they can actually, depending on how large they are, start to press on the nerve root, which you kind of see in this one. Now this example, and the example that you typically see in more of a medical textbook, it really looks kind of like this one, where it's out all the way, it's really pushing on the nerve root. And if you're having loss of bowel or bladder function, if you're, just your foot's completely going numb and dropping on you and you're tripping over your own feet, if you're falling for no reason, those are some signs that there may be a really, really serious nerve compressive issue. It could possibly require surgery. But things just like some numbness or tingling in your leg, or pain that shoots down and radiates into the back of your thigh or even your calf, it's a sign that the nerve's probably being irritated, but it's really not a surgical issue. Really, truly, if you're not having bowel or bladder issues and not having just weakness really that's almost causing you to fall, surgery is really probably the last resort. And then, down at the bottom, thinning discs, that's just kind of a progression on the degenerative discs, and the disc degeneration with osteophyte formation. Osteophyte basically means it's an area where your body lays down extra bone. And when you start losing height in your discs, the spine becomes a little less stable, and your body makes a normal reaction to an abnormal stimulus. So those osteophytes are actually an adaptive phenomenon that they help give you extra stability. So it's actually a good thing that your body lays those down if you have a degenerative disc. It makes your spine more stable. Oops. So again, I mentioned there were some statistics, and move this box out of the way. This is a chart of age-specific findings in asymptomatic patients, meaning people who don't have any back pain at all. These are some findings that you find in people with and without back pain. And as I mentioned before, disc degeneration in your 30s, about 50% of people without any pain have some disc degeneration at least one level in their spine. This signal height loss starts becoming, more than half of people without pain have that in their 40s. Disc height loss, that's more, 45, 50, when that starts becoming more than half of the asymptomatic population has it. Disc bulge it becomes more common age 50, age 40 to 50. Protrusions, you can see throughout the lifespan, those protrusions, and that's kind of the big one you saw, the herniation on the last slide. They stay right around 30%. About a third of people have them throughout their lifespan. It never really gets to 50% of normals having them, because that is a phenomenon that's a little bit more correlated with having back pain. Disc degeneration, disc bulges, disc height loss, degenerative discs, none of those things really correlate very well with back pain. You can look at two people's MRIs, and one person might have a great MRI and be in a whole lot of back pain, and the other person might have a really horrible looking MRI and have no pain at all. And I've had patients actually tell me that surgeons will take an MRI of their back and say, "Wow, this is the spine of a 70-year-old." But they don't have back pain, and so it just kind of tells you that the findings that you see on the MRI do not determine your outcome. That even if you have some bulging discs or degenerative discs or even herniated discs, as long as you're not having changes in bowel and bladder function or your loads are acting on you, they can oftentimes be treated conservatively. And a lot of times the solutions are really pretty simple. So what does pain stop you from doing? These are really kind of the things that drive people to come seek medical treatment in the first place. It's not because, hey, I sense that I have a bulging disc in the back. It's not because, hey, I sense that I might have a herniated disc at L5. It's because my back hurts when I sit for more than 20 minutes. I can't stand in line at the grocery store without my back going out on me. I have to find a bench in Walmart just to sit down because I can't make the whole trip walking through the store without back pain. My friends are not asking me to walk anymore because I slow them down and I have to take so many breaks. I'm doing chores around the house and I can't bend anymore. Every time I go to pick something up, it feels like my back's going to give out. Or lifting things, lifting becomes a problem. And so I'm going to take a moment to kind of go through each of these problems, and each of these really common problems, the sitting, standing, walking, bending, lifting, and sleeping, and just kind of give you some common tips that you can use that a lot of people really don't know. And even sometimes people do things trying to protect their back that actually makes the pain worse. And so kind of go through some general tips. And again, there's different types of back pain, largely depending on your body structure. That taller people, this advice is not going to work as the same way it's going to work for shorter people. Thicker people, it's not going to work the same way it does for thinner people. But for most people, these are pretty good tips. And like I said, if you have any questions about your specific situation, I'd be happy to answer those. But first, sitting. I'm going to bring the camera down here and kind of back away from it a little bit. That a lot of people, they're told from the time that they're young, sit up tall, sit up straight, don't slouch. And so they almost take that to an extreme. That they sit up at the edge of their chair, sit up nice and tall. Some people even go to the extent of sitting on exercise balls or things like that because they want to strengthen their core. But sitting is really, it's an activity that it should be restful. And even looking back in history, you look at pictures of the ancient Greeks who were pinnacles of health. And you watch them and they're reclining, lounging at table, lounging in their baths, going back to even biblical times. They describe a glass up for the people who were reclining at table. That you're really not meant to sit up nice and tall like that. And I see brushing my teeth, almost fell into the sink. So yeah, we'll go through the sanding here in just a moment, Dale. But a lot of it with the standing is the same, is that people almost get told that they should be in a hyper upright posture. And it's good not to slouch like this. You don't want to sit like this all day. That's not good either. But there's a happy medium. And your spine, and of course, give me like 2 seconds to grab the spine model that I forgot on the presentation. Sorry about that. So here's the model of your spine, and normally it should have some back and forth curves. It's almost kind of S-shaped. It shouldn't be straight up. It also shouldn't be like a C-shape. It should just have kind of a mild curve. And actually, the way that we see this a lot of times, it's kind of disorienting because the way it was really designed to function was like this. So it puts the strongest point of your spine vertical with gravity, and all the compression force of gravity is going through the bodies. Sorry, I'm on the wrong side here. Going through the bodies of the vertebrae. And your muscles really, when you align your spine right, you shouldn't have to do it. They should keep you in a pretty good alignment just based on the strength of your spine and the discs and the ligaments around it. But we've kind of been taught, stand up tall, keep your back nice and arched, don't slouch. And so we get more of a position where people are actually kind of functioning like this. And you can't see the accentuation quite as much. It almost becomes like a bow and arrow. And if you push down on the top of a bow and arrow, it's going to buckle kind of at the middle. And that's really where a lot of people tend to get their back pain, is the lower segments there, the L3, L4, L4, L5, L5, S1, are really the things that come up most commonly on x-rays or MRIs, or even just the location where people say, hey, it hurts right down there, right above my belt line. That's where people tend to find their back pain a lot of times, just because that's how the human spine is built. But if you tilt it forward just a little bit, which a lot of people feel like then that they're slouching, because that's not the way that we were taught is good posture, so to speak. It actually puts your spine in a better position to do that. And when you're sitting, if you sit up at the edge of your chair, there's a lot of arch in the back. The muscles are under a lot of tension to help hold you up like that. It's not a restful activity. What's really a better way to sit for most people is to get all the way back into the backrest. And you see those lumbar supports a lot of times. Most people actually don't need that. Most people are better off just to get flat up against the seat. Now, there are certain types of people, particularly taller people, a lot of times people over 6 foot, people who have a true bulging, a true herniated disc, where bending forward sends pain down their leg, causes numbness and tingling. And sometimes people who have a true herniated disc actually do benefit from helping keep a little bit of arch in their back, but not maintaining it on their own, having something else contribute. But I'd say for the large majority of people with back pain, well over 50%, just getting all the way back in the seat where your back's flat on the chair is the best way to sit. Having good arm support, where you can rest your arms easily with the elbow bent about 90 degrees. You shouldn't be up by your shoulder there. You also shouldn't be down by the waist. Having a chair where you can have good arm support, it takes stress off your upper back and your neck too, which is really what this presentation is about. But if you're looking at chairs, you want something that's adjustable, has a lot of different features. In one of our blog posts, we linked to a pretty good one. But you want adjustable armrests, adjustable seat height, adjustable tilt and recline, and you want it to hit at a height where your legs are right around 90 degrees. For some people, who have more of that extension-based back pain, having your knees actually up higher than 90 degrees or lowering your chair down lower, or putting your feet up on a step stool, it helps flatten your back out more into the chair and actually can help give you a little better relief. For people who are taller, and standard chairs aren't built for your size, for people who are 6 foot and over. And so actually raising the chair up a little bit so it does put you in a little bit more of a tilt like that, and your legs go at greater than a 90-degree angle. It's helpful for taller people. I'd say people who are, less than 6 foot, definitely 5'6" or less, getting more into a 90-degree or even knees slightly higher than pelvis is going to be best for a lot of people. Standing, I saw a question in the chat that had a back issue. My challenge was brushing my teeth. Almost fell under the sink. So when you're leaning over, you lean over like that, the muscles that are here in your back have to work to hold your spine up. And that's also counterbalanced by the muscles in your hips run from your bottom to your hips or to your legs that help to hold you up. So there's a combination of the muscles in your spine and the muscles in your legs helping hold you up. If you're bending, and I'll show you on the spine model, then show you just myself standing, solely from the back, where your spine is doing all the bending and your hips aren't moving at all, then you have to do a lot more of that force with just the back muscles. Versus if you can get your hips into it, get your hips out behind you and kind of almost stick your bottom out, it uses the stronger muscles in your butt and your hamstrings to help hold your body up. And so when you're standing, I guess this would be more the bending aspect, but when you're bending, such as you're standing by the sink to brush your teeth, for one, you don't want to stand there for 2 minutes, however long you're brushing your teeth like that. You want to try to put your toothpaste on, brush your teeth standing upright, and then when you're done, stick your bottom out behind you. You push your hips backwards and hammer down just a little bit. If you push your hips backwards when you're bending, you share that force between your spine and your hips, and your spine actually stays pretty straight, pretty flat throughout the movement. It's more about hips back, hips forward, hips back, hips forward, rather than if you either have really tight hamstrings or you just don't think to get your spine into it, or you're standing right up against the counter and trying to bend over the sink like this for 2 minutes, your spine muscles have to work really hard and are under tension for a long period of time. And that's when they tend to get tired and sore, and it feels like when you go to get back up, they just can't get you. You might even get like a catch or feel like you're going to face so the better way to bend, one is to avoid sustained bending for a long period of time. And two, that when you do go to bend something, or jumping down a little bit here, going to lift something, that when you go to bend, stick your hips back. When you go to come back up, stick your hips back forward. We're going to lift, say, a trash can here. When you go to bend your knees a little bit, stick your hips back. You don't have to get like this, where people say bend at your knees, not at your back. Don't let your back bend, keep your back straight. That's actually not really great for you. It's a lot harder to lift like this way, getting way down low, than it is to allow your knees to bend, but also allow your spine to bend and come back up. The closer you stay to something when you're bending and lifting, as opposed to lifting out there, there's a lot more torque coming down. There's a lot bigger distance, a lot bigger lever arm, if you remember physics, pulling down on you when something's out there, versus when it's right underneath your center of gravity. There's barely any distance between your center of gravity and what you're lifting. So the closest you can get something in that you're lifting to your center of gravity, sticking your bottom out behind you, and then pushing your hips back in. That makes it a lot easier to lift and probably a lot less painful. Kind of jump back, I skipped around there a little bit. So just regular standing, and for some people, they feel fine walking, but then when they're, say, standing in a grocery store or somewhere where they're going to have to be standing for a longer period of time, in a more static position, or standing at a party, or standing at a graduation, or football game and something like that. We're not sitting down all the time. You want to try to position your spine kind of like we talked about, to where you're slightly tilted forward. And to some people that feels like you're slouching or leaning forward, especially if you're used to kind of living in more of an extended position. And a lot of people walk around, you can walk through a mall when you're allowed to go out places and actually go see people. When you are leaning back like this, it puts your spine in a bow and arrow position. And then there's a lot of compression on the joints there. It closes down the spaces where the nerves come out of the back. So a much better way to stand is to kind of tilt your pelvis underneath of you, to roll your pelvis under, to where you're lined up more in that kind of natural position of your spine. And I'll show you what that looks like more on a person level now. So instead of standing with your back arched like that, almost thinking about lifting your belt buckle up a little bit, rolling your pelvis underneath of you. And I tend to stand with the forward tilt. You can see how my belt naturally kind of slopes downward, versus when you do more of a pelvic tilt, the belt becomes more horizontal. Now, a lot of people, they try to pelvic tilt and they'll do this. They'll bring their belt up, but they bring the rest of their body back with it. So you want to keep your body in the same position, pelvic tilt like that. And so really, it does kind of feel like it probably feels like you're slouching like this. You're not in reality. You're really just going from being back here to being more neutral. If you do feel like you're bending forward, a lot of people have mobility issues in the upper back as well, which they'll tend to hypercompensate because they can't move well in the upper back. So there are some tips and exercises and easy things you can do to get your upper back moving better, which makes you not have to compensate at your lower back. I'd be happy to go through that if anybody has more specific questions to work on that. And then sleeping, walking. We skip walking. Walking, really walking is an act of moving forward. That you want your body to be going in a position like that. That when you're standing, all the forces should be balanced. Everything should be stacked up on top of each other so that you're not moving anywhere. But walking is not the same thing as standing. Walking, it's basically like controlled falling. That you want to lean your body weight out until basically you have to take a step or you're going to fall. And then you just keep your feet moving up with your trunk. I don't really have enough space in here to walk. And I've got some past videos on walking that I can link to and send you some information on. But really walking, instead of, where you can see my feet, instead of pulling forward with your front foot here and kind of pulling yourself forward where you use a lot of hamstring, you really want to push off the back end. So you're leaning your trunk forward a little bit, getting your shoulders in front of your hips, basically falling until you need to take a step, and then your force is coming from pushing off of the back leg. And instead of reaching forward and being upright with your front leg and pulling yourself forward, your force should come from falling forward and driving off the back leg. Kind of like if you watch a sprinter coming out of the blocks in the Olympics. They don't stand straight up and then start running. They come out from a crouched position and they basically come out of the blocks like this. And they're going forward and accelerating and driving off their back leg. Same thing for walking, just not nearly as fast. And then sleeping, sleeping is another problem that a lot of people have with back pain. Some of it just because of the pain and other times for other reasons. But if it's just purely pain related, there are a couple positioning factors that can help a lot get more comfortable in that. For a lot of people, I typically recommend sleeping on your side with a pillow between your knees. And enough of a pillow that basically it keeps your hips or your knees about hip width apart. That it doesn't allow your knees to come together like that. It also doesn't allow your knees to spread way out to the side. It basically keeps your knees in a line with your hips. The other thing is that sleeping with your knees a little bit bent when you're on your side, it kind of flattens your back out, puts you more in that neutral curve than laying with the legs all the way straight. For that same reason, for people who have trouble with back pain when standing or when walking, or are more someone who tends to sit like that, laying flat on your back or laying on your stomach really isn't a great option, because it puts you in that arched spine position all night long. Now, if you are someone who has more of that typical herniated disc, that you're taller and your pain comes on only when you bend and it radiates down the legs, and you have an MRI that confirms that there's a herniated disc, those are some situations where, in those few cases, flat on your back or even sometimes on your belly is a good position. But I'd say 90% of people, on your side with the knees bent and a pillow between the knees, or laying on your back with pillows underneath your knees. But really, to get your back flat, it's not a small pillow. It's like knees almost up to 90 degrees, meaning probably 4 or 5 pillows. And for most people, particularly if you're not the only one in the bed, having 4 or 5 pillows underneath your legs is probably not what you're typically looking to do. So I'd say for most people, on your side with pillows between your knees is good. The other factor about sleeping is just some people can't get their brain to shut off at night. And so deep breathing, meditation, if you're religious, doing some prayer before bed, just trying to get all the stresses from the day that you've dealt with and get them out. Keep a gratitude journal, things that you're happy about that have gone well through the day, things that you're looking forward to the next day, and filling your brain with good thoughts so that there's not a lot of room for all those stressful thoughts to keep you awake. Because stress, it drives a fight or flight reaction. Your heart starts pumping, your breathing gets heavier, you're wide awake, your pupils dilate, your muscles get tense and ready to run or fight. It's what happens, when we're responding to an acutely stressful situation, whether that be a painful situation or emotionally stressful situation. And so just kind of learning how to manage your nervous system through things like, again, deep breathing, prayer, meditation, calming music, maybe a hot beverage that's non-caffeinated before. And those are all things that kind of help to start to get your system wound down so that you can get a good night's sleep. There's a whole set of rules related to sleeping called sleep hygiene, which I go through that with people a lot. Because when you're not sleeping well, things don't work well, your system's more sensitive, you're more sensitized to pain, that even little things that might not normally be damaging or perceived as harmful, your brain sees them with a higher danger value and the system's a little bit more sensitive. So getting a good night's sleep is really important to helping overcome any type of chronic pain, whether that be back pain or knee pain or neck pain or what have you, fibromyalgia, more chronic pain disorders. Sleep is vital. So if you have any questions about sleep, I'm happy to answer those. It's a big topic. It's an often underappreciated topic in our society. A lot of times we almost value people who are able to just keep going without any sleep and just run on fumes. And in America, we've got the American dream of work harder and you'll achieve more, but you have to balance that with taking care of your body so it's there for you to be there for you in the future. And especially now, that health and immunity are kind of at a new forefront of importance. Having your body at the top of its game and really functioning on all cylinders to fight infection and do what it needs to do to keep you healthy. It's important, and sleep's a big part of that, as is diet. And so, last question we had was, if I've suffered with back pain for more than 10 years, can anything be done? Do I just have to live with it? Am I just getting older? And like I mentioned, if you're 70 and you have some back pain, and you expect to feel like you did when you were 20, that's probably unrealistic. But, if you're 50 or 60 and you'd like to feel like you did when you were 40, that's probably reasonable. And a lot of times it's just a little bit of attention to detail for just the everyday normal things that you do every day. Some of the things that we went through, like how you sit, how you stand, how you walk, how you get in and out of a car, how you lift things. Those all play a much bigger role than any medication, any chiropractic manipulation, any massage, any physical therapy stretch. Anything that you do for 30 seconds or a minute or even an hour of exercise a day is going to pale in comparison to the daily lifestyle habits that you do every single day over and over and over the other 23 hours a day when you're not exercising. And so, we each have to live with it. It depends. If you're willing and open to making some changes and just kind of saying, okay, I still want, and I have typos all over this slide, I apologize. Will I be able to do things exactly in the same manner without thinking about them willy-nilly? And maybe you might have to make some changes in either the way you sit or the way you stand, or be a little more conscientious for about 2 months is how long it takes to form a new habit. Learning to do things a little bit differently, but that doesn't mean that you can't go hike. It doesn't mean you can't play with your kids or grandkids or lift them up or carry them. It doesn't mean you can't get back into golfing or swimming or biking or running or the things that you used to enjoy. Just being open to learning some new, better ways to do it that probably you should have been doing all along. And if you've been doing those things for the last 20 or 30 years, maybe you wouldn't have gotten into the boat that you had in the first place. But society drives a lot of that. A lot of people do things that they think are helpful, like sitting up tall or not slouching or lifting all with your legs and not using your back at all. I know my weight coach in high school said, keep your back completely straight. Don't bend when you have hundreds of pounds on your back. And that's really not great for your back either. It's much better to squat. That's really the way we talk about with bending. So there's a lot of societal things that have just been kind of passed down from generation to generation to generation. So, if you have been suffering with back pain for a long time, it's not your fault. You're just doing the best that you can based on all the information that you've been given in the past. But if that hasn't worked for you and you're willing to make a change and maybe try things a little bit differently, I think there's some good hope. And I'd be happy to help you with that individually, teach you some new, better ways to live. And then we also do some hands-on things, some massage and dry needling, and then other hands-on treatments to help people feel better faster. But that's all. It's just like every other treatment you've had in the past. If you don't learn the things that you need to do on the back end to help make all those things possible. So I think that was all I had really prepared. Let's see here. Any other questions that people have? I know that's kind of a lot of information, and I'll send out a replay of this this video call so that you can kind of look through it again and find out if there's anything that you were missing or that you'd like to see again. But any more specific questions that I didn't answer? No one wants to come on live. You can even just type into the chat and I can answer it honestly. Well, if there's no other questions, if you do think of something later after the call, or if you watch the replay of this and say, hey, maybe I did see something flash here. The communication between the spinal cord and the brain, can this cause a migraine? Absolutely. And there are a lot of different things that are triggered with migraine. Your migraines can be affected by the nerves in your neck, also the cranial nerves that go up into your head, and the nerves that go through the back of your head, as well as the blood flow. Actually, blood flow is a huge part of migraine. A lot of people take caffeine to help migraine because it causes vasoconstriction. It causes a decrease in how much blood flow gets into the brain. And temporarily relieves the pain. Latent sound. Those are things that, like I mentioned, there are different triggers that your nervous system is sensitive to. And you have light receptors and you have sound receptors. And when you do have a migraine, those triggers, they're all processed through the cranial nerves, light and sound. And because they're in such close proximity to your head and neck, those are a lot of times often really annoying to people who have migraines. Calming down the system, both through largely dietary approach, is big on migraines. Deep breathing, just learning some practices that you can do to relax, as well as head and neck posture, which we really didn't go through a ton on this call, but a lot of people in today's society, we work at computers, we work at desks, and spend a lot of time like that, where instead of the back muscles, the neck muscles are working really hard to hold this bowling ball up on top of our neck up all day long. And that can create some trigger points, some tender areas in the muscles in the back of the head and the neck, which play a big role in migraine as well. So I'd say posture, sleep, deep breathing, getting adequate oxygen are some really big triggers for migraine. And then, if light's a trigger, wear sunglasses when you're out in a bright room. If you're someone who knows that you have light triggers, bring ear plugs or noise canceling headphones if you're going to be going to like a concert or a baseball game or something where it's going to be really, really loud, and that's going to be more of a trigger. So kind of understanding your triggers and being prepared for ways that you can get around them are important things as well. How many people are they need surgery but don't really require it? That's a loaded question. I think we definitely are surgery happy in this country, not just for back pain, but it's a quick fix society. You can order anything you want in the world off of Amazon, and it shows up on your door in 2 days. And it's easy to see the picture on the MRI and say, hey, I have back pain, and there's this thing that looks wrong on the MRI. And hey, if we fix that thing that's wrong, then it should alleviate my back pain. And there's not always a one-to-one cause and effect. In fact, the correlation is pretty bad. But if that structural problem, if that herniated disc is 80, 90, 100% responsible for the pain, yeah, fixing that's gonna be helpful. And first time back surgeries for herniated discs that are pushing on nerves and causing like a drop foot or some progressive muscle weakness, they're actually pretty effective. But back surgery in general, the stats on it are really about 50-50. 50% of people who have it are successful, and 50% of people who have it are not successful. And that could probably be raised, like you mentioned in your question there, by better selecting the people who need it in the first place, and maybe taking some more time with people and ruling out the ones who don't need it by not providing it as quickly. try some other things first and really find out what is the true cause of this. Is it structural, or is it nerve related, or is it maybe just some posture things that, hey, if I fix the way I sit in the chair and sleep at night, I feel a lot better. And I'd say if you rule out all of those other causes and you've addressed everything else and you just can't rule it out, it's worth a shot. Second time back surgeries are actually, the failure rate goes down significantly. So if the first one didn't fix it, chances of the second one fixing it are even worse. So I guess I didn't give you an exact number on how many people are there that need surgery and don't really require it. Really, they say about 5% of back cases really require surgery. Those are the really serious, the severe nerve root compressions, the things that become a little bit more emergent if you don't address them right away. But 95% can probably be treated conservatively, or should at least be given a pretty valid chance before time to do surgery. Any other questions? I appreciate you guys all joining the call today. If you do have any questions, again, here's my contact information. I'll send out this replay, as well as you should have an email from me which has all this information in there. So feel free to reach out with any questions that you have now or in the future. As I mentioned with some of the migraine things, I don't just treat back pain, I treat chronic pain of just about any type, because it really, chronic pain is a system problem with some tissue problems superimposed on top of it. And so a lot of the things that you use to treat chronic back pain, treat chronic knee pain, treat chronic neck pain, treat chronic migraines, a lot of those system variables are the same. The stress management, the breathing, learning how to turn the system down. And then some of the specific things, the tissue-based things like we talked today, are going to be a little bit different based on each part of the region. But happy to help you out with any questions.